Schistosomiasis is a parasitic disease caused by schistosoma worms acquired through contact with fresh water contaminated by infected snails. The parasite enters through the skin and travels in the bloodstream, leading to intestinal or urinary tract problems depending on the species.
Schistosomiasis is caused by schistoma parasites. People get infected when they come into contact with fresh water contaminated with the parasite. This usually happens in rivers, lakes, rice fields, and irrigation canals that contain infected snails. Poor environmental sanitation and open defecation also increase the spread of the parasite in water.
Schistosomiasis is transmitted through skin penetration when a person comes in contact with fresh water contaminated with mercury, which are released by infected snails. The parasite enters the body through intact skin during activities such as swimming, bathing, or washing in contaminated water.
And now, let's talk about symptoms for schistosomiasis: fever, chills, cough, muscle aches, diarrhea, abdominal pain, enlarged liver or pain.
For the diagnosis of schistosomiasis, stool or urine. Microscopic identification of eggs in stool or urine is the usual method for diagnosis. Stool examination should be performed when infection with S. mansoni or S. japonicum is suspected, and urine examination should be performed if S. hematobium is suspected. Eggs can be present in the stool in infections with all the schistosoma species. The examination can be performed on a simple smear.
The main treatment for schistosomiasis is praziquantel, which kills adult worms. A repeat dose may be needed if the infection persists. Pain relievers help with symptoms, and corticosteroids are used for severe inflammation.
Schistosomiasis can be prevented by avoiding contact with fresh water that may be contaminated with the parasite. Wearing protective clothing like boots and gloves when working in water can reduce the risk. Maintaining proper sanitation and hygiene, such as hand washing and using clean toilets, help stop the spread of the parasite.
Ascariasis is a parasitic infection caused by the roundworm Ascarias lumbricoides. It occurs when a person accidentally ingests eggs from contaminated food, water, or soil. The larvae migrates through the body and mature in the intestines, often leading to abdominal discomfort, poor nutrition, and growth problems in children.
Ascariasis is caused by the roundworm Ascaris lumbricoides. The main cause is ingesting the parasite's eggs from contaminated soil, food, or water. This often happens because of poor hygiene, not washing hands, or eating unwashed vegetables or dirty surroundings. Open defecation and improper waste disposal also contribute to the spread.
Ascariasis is transmitted by ingestion of infected eggs found in contaminated soil, food, or water. Poor hand hygiene and consumption of unwashed vegetables are common sources. Once swallowed, the eggs hatch inside the body and mature into adult worms.
Ascariasis symptoms. Many people have no symptoms but if present, dry cough, wheezing, fever, intestinal phase, abdominal pain, nausea, vomiting, and poor appetite.
For the diagnostic of Ascariasis, first, stool test. Mature female Ascariasis worms in the small intestines starts laying eggs. In time, these eggs can be found in the stool. Your healthcare professional checks your stool for the tiny eggs and larvae, but eggs won't appear in the stool until at least 40 days after you are infected. And if you are infected with only male worms, you won't have eggs in your stool. Second, blood test. Blood tests can check for a higher than usual number of white blood cells called eosinophils. Ascariasis can raise your eosinophil level, but so can other health conditions.
Ascariasis is treated mainly with albendazole or mebendazole, which kill the adult worms. If the infection persists, a repeat dose may be given. Surgery is rarely needed, only in cases of intestinal blockage or other serious complications.
So Ascariasis can be prevented by practicing good hygiene such as washing the hands with soap and water before eating and after using the toilet, washing fruits and vegetables thoroughly, and drinking clean and safe water and keeping the environment clean through proper disposal. Avoid walking barefoot on soil that can be contaminated and participate in regular deworming programs to lower the risk of infection. Capillariasis is a parasitic infection caused by Capillaria worms, usually Capillaria philippinensis, that affects the intestine, and it is commonly acquired by eating raw or undercooked freshwater fish containing the parasite, and it can lead to severe diarrhea, abdominal pain, weight loss, and malnutrition if not treated.
Capillariasis is caused by the parasite Capillaria philippinensis. People become infected by eating raw or undercooked freshwater fish that contain the larva. Unsanitary food preparation and consuming unsafe or improperly cleaned fish increase the risk.
Capillariasis is transmitted by eating raw or undercooked freshwater fish infected with Capillaria philippinensis larva. Humans become infected when they consume fish that harbor the parasite, which then develops in the intestines.
Capillariasis symptoms: chronic abdominal pain, severe weight loss, weakness and fatigue, swelling of legs, protein loss, malabsorption, and electrolyte imbalances.
For the diagnosis of capillariasis, the specific diagnosis of capillariasis is established by finding eggs, larvae, and adult worms in the stool or in intestinal biopsies. Unembryonated eggs are the typical stage found in feces. In severe infections, embryonated eggs, larvae, and even adult worms can be found in the feces. No valid serologic testing is available for diagnosis.
Capillariasis is treated with albendazole or mebendazole to kill the worms. Supportive care is given to manage symptoms such as diarrhea or anemia. Surgery is rarely needed and is reserved for severe complications affecting the intestine or liver.
Capillariasis can be prevented by carefully washing fruits and vegetables to remove any contaminated soil or water. Avoiding raw or undercooked freshwater fish is important since the parasite can live in fish. Practicing good hygiene such as washing hands before eating and using clean water for cooking and drinking also reduce the risk of infection.